I suppose that leads me to a question to you, Charlotte, which is that if a lawyer does have a suspicion, what next? Because I know that you're quite bound by client confidentiality. So what do you think the best next steps are?
I think it's very difficult. I think it always helps in that a lot of the meetings that we have with clients, there would be another person present. So you've almost got that sort of check and balance in place. If you've picked up on something in that conversation that doesn't feel quite right, as you said, in terms of intuition, you've at least got someone who was present in that meeting that you can run it past and say, did you pick up on that? But I think if you both have identified that there may well be an issue, the next step is, I think, to have that difficult conversation with the client. And I think it's the one that most solicitors and advisors hesitate and are very uncomfortable about having. But I think, as we've touched on in the past, in previous conversations, actually, solicitors' offices are probably one of the most intimidating places in the world. And I think perhaps one of the first things that we would do is try and suggest having a meeting with that client at home or in an environment where they're more likely to feel comfortable and may well perhaps open up to you. Because I think, in my experience, sometimes clients actually know that something might not be quite right, and they've done a pretty good job at hiding it. I mean, you must see that people will go to great lengths to hide, perhaps if they know that something's happening and they're trying to deny it, and their behaviour may well be affecting how they treat other people in their lives. They really don't want anyone else to suspect it.
Well, you've brought up two very interesting points. The first is going to people's homes, because, of course, people will feel more comfortable there, less intimidated. But it can also, certainly from a clinical perspective, but also, I suspect, from your perspective, can give you significant clues as to what's going on and whether there are real problems. And, is the environment safe? Is it clean? Is it well ordered? And then, in terms of the breaking of news or the discussion, then I think that is definitely best done in a person's home.
In some ways, you can use the law to your advantage, in that you can say, well, you've made this decision. I totally understand and respect that decision, but others might be surprised by it. And if we want to make sure that your wishes are respected, either after your death or at a point in time where you may lose capacity, the best thing to do is to make sure not only that it's properly documented, but that actually we get a formal assessment carried out as in a kind of insurance policy to protect your decision making, which makes it a bit easier for the advisor, and you can distance yourself from what might be perceived as a challenge to their capacity, something urgently, which puts us in a very difficult position as lawyers. The last thing you want to do is take a step that day which they may well question, challenge the next day, or confirm that was never actually the purpose of their instructions. And so what we would normally do there is you would go back to the client, confirm in writing what you discussed on the call, and ask them to confirm their instructions in writing. Again, that's fine if you're not up against it in terms of a deadline. If you have got deadlines, you're in a very difficult position if you think that person was under the influence of alcohol or drugs and therefore not necessarily giving you their firm views.
Working jointly and ideally seeing the client together. I think that's ironclad if there's the lawyer and the doctor in the same room at the same time.
I think so, because I think it puts into context, doesn't it, the questions that are being put to the clinician about the specific decision that's being made. And I think touching on the point that you've made about the sort of take-home points from this discussion and from more general experience, it is that I think as a lawyer it's very easy to fall into that common trap of someone's come in to see me about a will, it all seems very sensible. They seem on the surface entirely sensible. But without scratching the surface, I think it's very hard for that lawyer to be able to say hand on heart in their notes of that discussion that there are no concerns as to capacity without having really spent some time getting to know that client, getting to know the context for their discussions, and also trying to get a better understanding of them and their family. And as you said earlier, in terms of there might have been a traumatic brain injury in the past, which may well be affecting what's going on in that discussion. And it's all about getting to know your client and their other advisors, whether they're clinicians or other financial advisors and accountants, and really making sure that you've got the full picture in which to be able to put the specific decision that you're considering at that moment in time. James, thank you very much for coming into our offices. I know you've been seeing patients today, but it's very nice to have been able to speak about these issues in person.
It's been an absolute pleasure, and thank you for inviting me to such a beautiful office. Really wonderful, thank you.